as for example, in chronic leukemia, and specifically the lymphocytic chronic leukemia that appears too later in life, as I mentioned, the mean age of diagnosis will be 71 years. We prefer to do treatments that are not too invasive to the patient, because the life expectancy of this patient will not be really longer. This type of leukemia will not need always chemotherapy, but the other types of leukemia, normally we use chemotherapy as the first stage and as the first treatment of this disease.
Of course, there is where I would say that that depends on your own definition of chemotherapy, because even in some books of pharmacology, antibiotics are listed under chemotherapy, because chemotherapy basically are chemical products that we use as a therapy, as a treatment. But as years have passed, we have used that term exclusively for certain medications used in cancer. So basically, when we think about chemotherapy, we basically think of a person that is receiving IV medications that will lose hair, that will start having secondary effects like vomit and having like not a very good time. That's our conception of chemotherapy. And when we are talking about that, then the answer is no, not all the patients will require that type of chemotherapy. Every patient will require medical treatment and medications usually, but not all of them will require that aggressive. Some patients will need one of those medications that I mentioned, that they are oral pills and they will need it once a day, for example. It's also in a wide way considered chemotherapy, but in the traditional and widely concept, it's not that such harsh chemotherapy. I don't know if I explained myself.